joining us today to discuss these topics and much more is Mr. Charles Waldegrave. Charles Waldegrave is a psychologist and social policy researcher. He leads the Family Centre Social Policy Research Unit in Wellington, New Zealand. And Charles is also a joint leader of the New Zealand Poverty Measurement Project, which has provided the evidence base for housing, income, and other social policy changes that have reduced poverty in New Zealand. Charles is also a joint leader of the New Zealand Longitudinal Study of Aging, as well as two National Science Challenge funded research programs in New Zealand. So welcome, Mr. Waldegrave, and thank you so much for joining the Global Café all the way from New Zealand at quite a tough time, but thank you so much for joining us.
Thank you. If I can just greet everyone, Katrina. I'm from New Zealand, and so we normally greet people in the Indigenous language, Māori language of Aotearoa, New Zealand. Ki te whakamoemiti ki te atua, mō nā manakitanga, me nā āwhine ki a mātou. Nā rangatira mā, nā kaumātua āwhine mā, tēnā koutou. Mihi nui, mihi aroha ki a koutou. Nō reira, tēnā koutou, kia ora koutou katoa. I'm just acknowledging the creative spirit that brings us together and greeting you all as senior people in the field of providing help and support for older people, and greeting you in love, then greeting you once, twice, and three times. Kia ora.
Thank you so much for doing that greeting, and we'll sort of be able to get into a little bit more of some of the work that you've done with the Maori and some of the kind of important work that you've done in New Zealand. So I want to start at the beginning. At Global Café, we always kind of like to go back to kind of the origins of your career and how you've got to where you are today. So I'm wondering if you can start by telling us a little bit about what led to your interest in social policy and how you ended up in the field of social policy research.
Yeah, well, we set up an organization called the Family Centre. It was actually, my background is a psychologist. I'm also actually an Anglican priest. So I've trained in theology and psychology, but I was working as a psychologist. And we set up one of the first family therapy organizations in New Zealand. And it was working with families in a therapeutic sense that we began to realize that there were certain groups of people who were really much more impacted by external factors outside the family, things like poverty, bad housing, racism, external factors that impacted abuse, these types of things. And over a period of time, we became concerned that a lot of our therapeutic work was dealing with the sort of symptoms of these problems, like people being very depressed or having psychological problems, having social problems, struggles within families, and so on. And so when we tracked the stories of many people, not everyone, of course, but many people, we found that it was over a period where there was a lot of unemployment in New Zealand, increasing poverty, far greater difficulties economically than we'd had previously, and many of these things impacted on people. So we felt that what we were doing in therapy was sort of successfully helping people become undepressed or addressing their initial mental health problems, but not actually dealing with the core problem that was causing the problem, which was things like unemployment, housing, racism, sexism, these types of things. And so we decided to move into a community development framework as well as therapeutic. And we did a lot of community development work. And the more we did that, the more we realized that in actual fact, social policy and economic policy was critical. to people's lives. And so we progressed from that, and we moved pretty quickly into research and into poverty studies. It's sort of cutting a long story short.
Yeah. And I guess now we would be familiar with all of these things as being kind of social determinants of health. But I'm wondering if you had those tools at the time that you were kind of thinking about this and seeing these things manifest in therapy.
Well, we were worried that what we were doing, and what a lot of psychological work does, was actually, from one perspective, making people happy in poverty. It wasn't dealing with the problem, that the causal factors. It was dealing with the symptoms. So we wanted to get much more to the causal factors. And what was crucial to that was that there were certain groups in our society that were much more affected than others. And these were people on low incomes, Maori people, the indigenous people of New Zealand, and Pacific people who'd migrated here from Pacific Island countries. And so we started employing people from these different cultural groups. And we set up an agency with a Maori section, a Pacific section, and what we call a Pākehā section here, which is basically everybody else, but mainly people of European origin. And we worked independently and interdependently. We shared resources, but we took the cultural factors seriously, and people's way of life and way of thinking seriously, and then addressed these fundamental issues of inequity and social exclusion from those perspectives.
Mm-hmm. So I want to ask a little bit more about the work that you've done on poverty, because we mentioned kind of in your bio that you've been part of this New Zealand poverty measurement project. And so I'm wondering if you can share a little bit about that work, and also how that led into looking at the conditions of older people.
Yeah. Well, we got into poverty because it's such a prevalent issue. And at the time, New Zealand had no official poverty measurement, no recognized measurement. So whenever we alerted people, either through papers we wrote or work we did on the media, or things we did to try and prevent poverty, or alert people to the seriousness and how it needed to be addressed much more efficiently, politicians could just say, well, we were just being subjective. We had no proof. There was no evidence and whatever. I mean, there was evidence, but it wasn't evidence that was acceptable. So we developed, we worked with I'm a psychologist, so we worked with some economists, and we got funding and developed a project called the New Zealand Poverty Measurement Project. And basically what we did was import into New Zealand the methodology of that OECD uses and the European Union used to measure poverty, which was to work out a percentage of the median income and to identify where the poverty line was in New Zealand. And once we were able to do that, we were then able to disaggregate that data into the impacts on Māori, the impacts on women, the impacts on sole parents, various other groups, the impacts on those who were employed, different tenure types, and so on, and actually provide an enormous amount of proof. And this became quite a debate with government. And in fact, it led to, amongst other, all sorts of other pressures as well, but it led to a change in government, and governments that were really prepared to measure these things. And, eventually these things became part of the law, the way in which we measure and legislation and policy. And so these figures that we developed back prior to the 21st century are now just standard measures that everybody accepts in New Zealand.
Mm-hmm. And I'm wondering, if you can share a little bit about what what were the conditions for older people that came out of that? And you mentioned disaggregating the data, which I think is super crucially important, which we often don't do. And we find, I think, often that the data may exist, but it doesn't exist specifically for older people or other groups.
Yes. Well, we did disaggregate for age. The interesting thing is, at that time, older people were one of the better off groups. This is not the case now, but in the late 20th century, they were better off groups because New Zealand has a unique universal superannuation scheme. Everybody gets the pension at 65, regardless of whether you're working or not, and regardless, it's not means tested. It's universal for everyone, and the generation then that was 60, 65 and above had grown up in a period of quite a lot of prosperity, when there was a lot of government incentive for people to own their own homes. And so the vast majority of people owned their own homes and the superannuation, just what they received from government, was minimally adequate, for a decent standard of living. Most people had additional money apart from that, but it was adequate. What's happened since is we've had a housing crisis. So the whole basis for setting the superannuation is inadequate and hasn't changed. And as more and more people, as in most countries, have moved into this age group, governments are very wary to increase the amounts apart from the inflationary, the annual inflation increases. And so now we have much more widespread poverty amongst the lower income end of older people in New Zealand.
And, I think this is something, obviously this is kind of a global phenomenon, or especially in the high income countries, I guess, is A, kind of a housing crisis, and B, just the increasing numbers of older people and population aging and what that means for pension systems and all types of social and health systems. So I'm wondering, is there kind of have you been able to make any kind of cases to New Zealand governments and things like that these things actually we need very clear solutions to these things? And I'm wondering if there's anything that you can share kind of for a global audience that might be of use in the countries that we all work in.
Well, one of the difficulties when we did the poverty research, the group that was the worst affected were children. The highest levels of poverty were amongst children and households with children. So the poverty research was very effective in beginning to lift the income of children and to start to address housing. However, the housing crisis grew, as it has internationally, but it grew faster in New Zealand. We actually have the highest multiple medium, the ratio of housing costs to incomes in any OECD country at the moment. It's just appalling, really. But so that's always worked against the lift in incomes for younger people. So what's happened now is there is a recognition now that as the incomes of other families, younger families, have been lifted, older families have been growing, and they're now having some quite serious difficulties. And we're getting homeless older people with needing emergency housing and stuff, because they don't have tenure. They don't own their own houses. If they don't have access to an affordable house, then they're in an unaffordable situation, and they're making choices between food and housing. And I mean, this is terrible. And so while there has been a lift in incomes as we've gone along through the situation, New Zealand has not solved this problem. But we've at least had much more evidence about it. And with the evidence, you do get some movements, but not to the extent that we could claim any great success at this point.
Mm-hmm. I guess we'll keep at it. All of us over here will have to keep at it and keep looking at solutions. But I want to just go to the chat. We have a question from Shmuel, who is a weekly participant in our global cafes, and who's asking, how do you create kind of suitable housing and living standards, and how does that support the well-being of older adults as a whole? And so I'm wondering if you can speak to New Zealand, but Shmuel's question also asks about kind of low-income settings in particular.
Well, I think, first of all, you've got to recognize how significant housing is. I mean, housing's where people live. Housing's where older people spend most of their time. It needs to be warm. It needs to have sufficient space, and people need to be able to afford at least the basics, and enough to be able to socialize and to interact with other people, and be able to at least minimally pursue interests, to have a well-rounded and decent life. Now, I think there's been, much more focus on physical health rather than the places where people live and the causal factors that create not only bad physical health, but bad mental health and so on. So there's not the emphasis on income and housing and the need for social connection and interaction and adequate resources for that as a primary preventer of many of the problems that we have. So, for example, we know that loneliness, creates so many problems for people today. Morbidity and mortality. But what we often think of as the way to solve that is just to connect people, whereas very often people would connect quite naturally if they actually had sufficient income and secure housing, and could feel the confidence to be hospitable and have sufficient resources to be hospitable and to go out to others.
Mm-hmm. Yeah, I mean, I think it's certainly pretty hard to prioritize, physical health or something like chronic diseases or things like that if you don't have that baseline of housing and kind of a shelter, and meeting some of those really most basic of needs. So I think, to me, it's fairly clear that this is so integral to overall health and well-being. So I'm wondering if you can share a little bit more about you spoke about some of the challenges in New Zealand in terms of older people owning their own homes and things like that. But I'm wondering if you can trace a little bit more of those challenges in terms of kind of the history of older people and also the housing crisis that you're seeing in New Zealand currently.
Well, New Zealand had a really progressive post-Second World War housing policy right through into the neoliberal reforms of the 90s. So post-war, there was a massive housing program, and people were incentivized through government into home ownership. And so in the early stages that we were doing poverty research, I mean, 85 to 90% of older people actually lived in houses they owned. That is reducing all the time now as the new cohorts come through. So what happened that changed that was the neoliberal experiment. So, if you think in terms of the experiments that went on when Reagan and Thatcher and those people were changing the whole way in which we looked at the welfare state. And they had a huge impact on New Zealand from the 1990s onwards. And successive governments never really addressed housing. It just slipped out of control. And the critical thing that happened was that as home ownership became unaffordable, more and more people rented. So then wealthier folk began to buy up housing, and the market changed, and that became unaffordable. And so people had to then move into emergency housing, the people at the bottom end of the rental market. And then that proved to be inadequate, and we have quite a serious homelessness problem now. Now, governments have really tried to work on that, and during COVID, the COVID pandemic, they used things like hiring motels, hotels, and stuff to house homeless people. But once the COVID crisis was considered to be over, of course, we all know it's not completely over, but once things returned to a sort of a semi-normality, that accommodation is not available anymore. And so we still have a serious problem of homelessness. And we're not really addressing the fundamental collapse from home ownership tenure down through private rentals and so on. So that's really affected older people, because more and more of those younger cohorts have come through. And so home ownership amongst people 60 and over is reducing every year as a proportion as a tenure proportion.
Mm-hmm. Yeah. I mean, it's hard to really understand how you fix some of these huge systemic problems, because they just feel so multifaceted in a sense. But I'm wondering if you've seen any social policy measures in particular that have been really important to supporting aging populations, and whether it's housing or addressing poverty or welfare systems or anything like that. And what can we learn from things that maybe have been successful or from things that have failed in the past?
Well, yeah, I mean, there are obvious things that are important. I mean, the difficulty that so many of our societies are having is that those that are older, I mean, this is obvious to everyone that's participating here, that the proportion of people in our societies that are older have grown exponentially. And so that does provide a financial pressure, but it's often underestimated the contribution older people make to the economy. I mean, many of them still work, many of them invest, many of them have contributed skills and all sorts of other things to the economy and so on. So that one of the fundamental things we've got to address is to ensure that people live above what is a reasonable poverty line. Now, we're very involved in income research for different age groups. We set the living wage, for example, in New Zealand, and we do a lot of work on minimum adequate income for people to be out of poverty. So that's one critical area. A second area is that you need a range of housing for the older population. Obviously, some people maintain living in apartments and houses and live in place, and so that has to be affordable and protected. And it's got to be in neighborhoods where people are safe. And there are neighborhoods in all our countries that aren't safe. And so they need to be made safe for older people, and they need to be user-friendly for people to get around and to mix, and that mixing and socializing itself is seen as part of the affordability. It's not just having enough to eat and to pay your rent. You've got to have enough to be able to link and mix with people. Mm-hmm. But also, if people get into villages and retirement organizations and structures, I think the best ones of those are those that preserve people's use of their own initiative. For example, I've just been at a conference in Australia where they're developing places there, villages, where people come and they continue to shop and cook for themselves where they would normally be in a day room. Instead of being in a day room, the supports for them are that they have their own internal supermarket, and they have people supporting them to be able to purchase their goods and to use their capacities within the village, rather than to be left and served by everyone and therefore lose so much more capacity through that. I mean, I think there's a lot of thinking around this that is going on and is occurring in some places, but needs to be much more widespread.
Yeah. I think there's, right now it seems as though we kind of have two extremes. You're either fully independent at home, or you're, fully dependent, and that's just not the truth of how older people really exist. So it's nice to see some of these kind of more different ways of thinking crop up to really enable older people to live kind of their fullest lives. So I do want to switch gears a little bit. We've talked kind of about housing, but we've also touched on a little bit about your work with specific kind of Indigenous populations in New Zealand, which I know is a huge part of the work that you do. So I want to switch gears and talk a little bit about some of the things that you've done in terms of bringing the perspectives and needs of these groups specifically into focus, and maybe we can also chat a little bit about older people within those groups. So I'm wondering if you can tell us about, firstly, a little bit about the Indigenous population in New Zealand, because I don't know that everyone is entirely familiar. But also, what is their experience of aging and some of these challenges that we've been talking about in terms of housing and poverty and things like that.
Okay, well, the Indigenous people of New Zealand are Maori, and they're increasing proportion. They have a younger demographic, and they're an increasing proportion of our society. So at the moment, they're about 18% of New Zealand society, and they'll grow to be about 25% as the population projections show. But one of the sad things and the result of colonization is that the longevity difference between Maori and non-Maori is about 8 years. And so they're disadvantaged in quite a number of ways. Now, the critical thing that we work with is that the mainstream settler society in New Zealand is basically European. It's becoming increasingly more Asian, but it's been basically European, and has a largely individualistic, nuclear family, secular type of culture. Whereas for Māoridom, it's a much more genealogically based collective society, where elders have a particular place, and spirituality is an important part of the way of life. So, as I mentioned earlier, we at the family centre where we work, we have a whole Māori section and a Pacific section, and what we call this Pākehā section, which is for Europeans. So the Māori workers within the family centre have led a lot of very important work in terms of working with their own people, and I've been privileged to be a part of that as well. And one of the key things we're trying to do is to develop Māori-specific social scales with older people. So older people are called either kaumātua or Pākeke. And what we've done, for example, is if you come from a genealogically based society and you've had a special place as an elder, and modernism is taking that place away from you a bit, it doesn't have the same respect that it used to have. It still has respect, but it's reducing. Your experience of loneliness is different from someone, say, who's in the Pākehā world, in the European world, where elders haven't had a particularly high status at all. In fact, they've probably had a lower status than other people in society often. And where spirituality and these things don't mean the same. So what we've been doing is developing with older Māori throughout the country. Māori workers have gone and had what they call hui, special meetings, using all the protocols, Māori protocols in meeting, and inviting them to talk about 6 areas. These are loneliness, social connection, well-being, discrimination, abuse, and neighbourhood well-being. And out of those discussions, the team has themed a range of questions so that you can have a loneliness scale and a well-being scale and a discrimination scale and so on. We've now taken those scales out into the field to test them, because they need to be tested for reliability and validated statistically. So we have just collected 1,900 national random sample of Māori 50 years and over, fully completed questionnaires. And in those questionnaires, we have standard universal type scales for loneliness and so on that are used by Europeans. And we have these co-created scales that have been co-created with Māori elders. And they are being tested for, we're just in the process of the analysis now. It's taken, COVID held us up in collecting the sample, but we're collecting those. And the whole idea of this is, in our pilot work on loneliness, we found that there were quite a number of things that were similar between the European scales and the Māori specific scales, but there are also quite a lot of differences. And so the Māori specific scales provided knowledge and evidence for policy and for funding initiatives where you would do things quite differently than what you do in a European world. And we think this might make a difference. So I know this is going on a bit, but if I could just do this last bit. Whenever Māori health increases, non-Māori health increases at the same rate. I mean, this happens in a lot of countries, and we don't close this gap. And our hypothesis is, if we actually collected evidence that was specific to Māori, rather than impose on them the universal scales, we might actually get information that can create policies that might help close that gap. That's what we're aiming for, and that's the point of all that research.
Yeah, I mean, I think it's super impressive and super admirable because I think we often don't have kind of culturally appropriate measurements or tools for research, and then that of course then bleeds into not having culturally appropriate interventions and then policy and things like that. And I'm struck by the numbers, because 18% is quite a big chunk of, and then going on to 25%, that's kind of a huge chunk of people that really it's, you know, I'm sure it's just kind of crazy that much of your population wouldn't be served. I mean, it's crazy to have any kind of marginalized group, I think, but to not be serving such a huge chunk of the population is really, you know, it showcases the importance of work like this. So we actually do have a question from Catherine. Catherine, did you want to unmute and pose your question?
Sure. This is really exciting because I see the work you're doing having an impact literally around the world. That if we can finally get government to see that there are differences and that the way one treats those differences can have a huge impact on the health. So I wondered if you could offer an example or two, just so we can learn from you. For example, how do the Maori face loneliness differently? And you said it obviously impacts elders differently, but is there across the board with Maori, are young people who are facing loneliness also facing it differently than the European measures show? Thank you.
Okay, well, just to touch on the international bit, I mean, what is interesting is that the numbers of people who have an individual nuclear family, secular approach to life are actually far fewer in the world than the people who have a collective genealogically based spirituality type of approach to life. So it's just that the people who've developed a lot of the measures just happen to be Europeans, North Americans, Australians, New Zealanders, who've sort of dominated the market for the way we measure things and the way we define things. So what has happened with Maori, I think, is very relevant for many other cultures and many other marginalized groups in societies. For example, many of the refugees come from cultures that have similarities like this. Many of the immigrant labor, many of the colonized countries, and so on. So I think this sort of research does have a relevance. I mean, that needs to be done differently in each place, but it does have a relevance across the world. But to come to your question about what are some of the differences, here's two examples. One of the questions we have in the well-being scale, I don't have it in front of me at the moment, so I can't remember the exact wording, but it's a question about do you have sufficient money to be able, do you have sufficient income to be able to provide hospitality for your guests and to give what they call a koha when you go to visit someone else? Now, it may seem a strange question, but what the elders continually told us was that they would rather go without than not be able to give a guest food. It's so basic in their culture to provide hospitality. And they would rather not visit someone in another culture visit someone, visit a friend, or even go to other members of their family if they couldn't provide something themselves, which they call a koha. So that this was a fundamental question about well-being, which you wouldn't have in a Western scale. Well, it's not in any Western scale that I've seen, and I've seen lots of them. Another other things that come up is about their need, the importance of spirituality in their sense of well-being, that they see spirituality very often as quite central. And so the secularizing of all policy and stuff is not helpful for them at a local a local level. They talk about living in Te Ao Māori, which means the Māori world. So as elders, some of them say, we were punished for speaking the language. This doesn't happen so much today, but it did happen decades ago in New Zealand. We were punished for speaking the language. We then spoke English. And now that we're elders, we can't fulfill our eldership role in our own communities because we don't even have command of our own language. I mean, these are the sort of depths of what colonization do to people. And they talk in terms of trauma in the way that that has impacted on them. I mean, I hope that answers the question for you. Yeah.
Yeah, thank you so much. I mean, it's so fascinating, I think, to get a look into those kinds of perspectives, and things that, that's such an interesting, idea that, of course, you wouldn't be able to pass on things because they were kind of not able to speak their own language and things like that. So I want to ask, what do you sort of see? Of course, doing this research then sets up, the goal would be to set up a great basis for interventions, and social policy interventions and things like that that really truly meet the needs of these groups. And it could be Maori in this case, but also I think, as Catherine was saying, this could be translated to other groups and things like that. So what is your advice to take some of the learnings that you get from studies like these and then mobilize into interventions or social policy?
Well, I think that there's been far too much one solution fits all. And these solutions are biased. And social science has not been honest about this bias. They're biased from a worldview that is fundamentally European, North American, and, like mainstream New Zealand, Australia. And they're not evidence-based for the people, for many of the people who live in these countries, and they're not evidence-based for people that live in other countries. So I think there needs to be much more tailored solutions, policy solutions, both social and economic, within countries and within cultural groups, so that we need to get critical. If we're going to have evidence-based policy, which all governments say they have, then we actually have to get the evidence from the people. I mean, in New Zealand, there's a huge renaissance of Māori culture. I mean, there's just absolutely amazing things that the Māori community is doing in New Zealand, and the recognition it has, and the schools, and the building of the language, and the resilience of the people. But the disadvantages are still really clear, and they're not fair, they're not equitable, and they're not inclusive. And so the point of this type of research is to start developing norms that are not just for one group, and the assumptions that if you ask a question, I mean, here's an example. In one of the main elderly scales that are used in longitudinal studies of aging, is a question like, if you're feeling distressed, do you have a friend you can talk to? It seems an innocent enough question. But when we took that question to Pacific elders and to Māori elders, they said to us, don't ask that question. And we said, well, why not? What's wrong with it? If you had to go to, they said, if you had to go, you'll embarrass everyone. If our elders had to go to a friend, that meant they didn't have anyone in their extended family to go to. Now, of course, that's not the intended point of that question, but that's the impact it has. So it's not providing evidence that's needed for them. They need evidence for their whānaus, their collective family well-being, or the urban families they create, and so on. And it needs to be based around their values and so on. So it's starting to get out of this one size fits all, getting much more co-created research rather than research dominated research, and which would make a big difference in my view.
Yeah, and I think it's a good lesson just for, if we think about all types of older people, it's not a homogeneous population, and so there's a range of different perspectives that we need to truly kind of have good evidence-based policy. So I'm wondering, how do you present this to governments? Because I know you work, quite directly, and I think you've had a lot of great success even in the work that you've done on poverty and aging and things like that, in terms of connecting directly with government. And so I'm wondering how you kind of make the case for exactly what you've just described of, we need, co-created research, we need to kind of have truly evidence-based policy.
Well, I mean, when you're working with government, there are two critical groups. There's the public service and there's the politicians. And the politicians, change depending what happens in elections, and you get left differences and right differences and all of that. So it's really important to work with the ministries, with the public servants and the groups that are creating policy and advising ministers, because they tend to be more constant. The politicians come and go. So it's a twofold thing. So it's really important when we do research and we have results, and they are important, that we get them. We do seminars and symposia with ministries and government, ministries of social development. We have an office for seniors in New Zealand with them, and it's a very responsive part of government, with ministries of health, and with finance, so that finance don't forget older people, and with housing and so on. So connecting with those people are important. But the other thing is to get the stuff out into the public domain, to get it into media, to get it into popular outlets as well, and to help the public to become much more informed, because that has a lot more effect on the politicians. And when you get governments that are really prepared to do social and economic things for older groups, and older groups are a significant voting bloc, start making them attractive to politicians, and reminding them of what their needs are and important ways they can impact. So I think too much research just stays in books and journals, which most people don't read. I mean, that's what everybody gets their promotion on in academia, but and they're important, of course. But it's to get that evidence out and discussed and work through, and to start, we haven't treated older people for a long time in the Western world with the respect that they've been treated with in other parts of the world. And there's room for a lot of debate and discussion around that and improvements that we could make.
Mm-hmm. Yeah. I see, Catherine, you have kind of a follow-up question. Did you want to pose your comment?
Well, it's just the cynical me. I mean, I think those of us who are listening to this are so excited about your research because it really validates the way I think we all think. The problem I keep encountering, and maybe it's just as I age, I see it more and more, is that supposes that the governments actually want diversity, want to retain the differences within societies rather than, as they always have, and you mentioned colonialism, it's existing everywhere today. So how do you deal with that? It seems to me more and more that it's civil society up against everybody else. And I include academia and researchers, of course, in that. Am I being too cynical?
Yeah, well, it's a struggle. I mean, but we've seen, really significant improvements in New Zealand. I mean, as I was saying before, there's a whole renaissance of Māoridom, and they have a lot more representation in Parliament than they ever used to have. And there are big debates, and there has been a movement of resources across to Māori, addressing historical grievances and stuff. Now, it's nothing like what it should be. It's nothing like what was taken off them, but it is substantial movement, and you're seeing younger generations coming through with huge confidence in their culture, very strong in their language, and making a very significant difference and contribution to the wider society, not just their own society, but the whole of New Zealand society. So I think it's really important not to lose hope. I think these things can advance. We get also movements that work against it, and we just have to deconstruct those and challenge those. And it's like anything else. It in a generation, there's only so much you can do, but every bit of movement forward makes a difference, and these things do change over time.
Mm-hmm. Thank you. That's a great response, very hopeful response. And I hope that we can all kind of carry that forward as well. So we are kind of coming to the last 5 or so minutes of the session. So I'm just going to take a few minutes to introduce next week's Global Cafe speaker, and then we'll come back to you, Mr. Waldegrave, for your key takeaway messages. So next week, I hope that you'll all be able to join us for Miss Nancy Hoden, who's the strategic advisor of the Global Coalition on Aging in the United States. And she's going to be chatting with us about the changing perceptions of older adults in mass media. So that is certainly going to be another great conversation. So we hope that you'll join us next Friday to continue more kind of thought-provoking discussions. So I want to end by going back to you, Mr. Waldegrave, and just for your final key takeaway messages after our conversation today.
Well, I think the important thing that I feel our work has focused on is to we need to think where people live. They live in houses. That environment needs to be good for people. So whether it's a collective group house, or whether it's an individual house in place, or an apartment, or it's with extended family, or whatever, these places, you know, homes have become commodities that people just sell and market, whereas homes need to be places that are secure, that are not damp, that people can trust, and homes need to be warm and friendly places. People need sufficient income to be able to socialize, to be able to connect, and they need safe neighborhoods so that they can do that, and accessible places where these things can happen. So all these things, I think, are really important preventive aspects. And there's been an enormous amount of focus on physical health. And of course, that's hugely important. And I'm not suggesting we slow that down at all. What I think is these broader aspects need to be taken into account. And then the worldviews of the people that live in them, that one size fits all just doesn't work. We have to be able to develop policies that relate to the world that people live in. And there are different cultures, there are different localities and different geographical regions. And we need to be much more tailored in the way that we respond and facilitate well-being with people in taking those dimensions and domains into account.
Mm-hmm. Well, thank you, Mr. Waldegrave. That was an incredible last thought to end on. And I have to thank you so much for sharing your insights with our Global Cafe, especially, I know it was a late one for you in New Zealand. So a huge thank you for joining us. And I hope that we can all kind of take some of your work forward in the work that we do in terms of creating really tailored, evidence-based work for the people that we're all working to serve, which are kind of many different types of older people. So a huge thank you for joining us, and thank you to everyone for being on the line with us as always, as well as the IFA staff that helps to put this on every week, particularly Bernice today and Roxana. And we'll hope to see you all at next week's Global Cafe.